caution as we head into the final weekend of November, and that is please exercise and restraint and responsibility when it comes to considering house parties or imagining having multiple people over. We've seen over the last several days that London Police and our own bylaw enforcement officers are not shy about issuing those $10,000 fines for hosting these types of gatherings, but those in attendance also face fines. We've had multiple examples this week, although I truly hope we don't have more examples to highlight come Monday. It's not because we're reluctant to issue fines when and where it's appropriate. It's because when fines are necessary, it means we've already failed in our primary objective, and that is to reduce the risk of transmission and community spread. You know, we'd much rather have no fines to issue because no one is breaching COVID protocols, especially in ways as flagrant as we've seen recently. Having said it, and to reiterate, officers will not hesitate to issue fines if they come across any individuals who are placing their own entertainment and enjoyment and self-indulgence over the health and well-being of others. Look, on a lighter note, we're proud to announce, we were proud to announce earlier today that we have our plans to open our 3 outdoor skating rinks in the very near future. City staff are working to open rinks at Storybook Gardens and Victoria Park on Saturday, December 5th, while the Rotary Rink at Covent Garden Market is on track to open the following weekend, December 12th. This is really one of the hallmarks of our winter season in London, and while I encourage individuals and families to lace up and enjoy the outdoor rinks, we also ask that everyone continues to follow all health precautions to ensure these spaces remain safe for everyone. Basically, if you show up at a rink and it appears as though it's getting crowded, come back another time when it's quieter. And when you're on the ice, maintain appropriate physical distancing and make sure you give an opportunity for others to enjoy the skating as well. And finally, as we go into the weekend, just the final caution that we've always ever said. We've talked about crowd sizes, and we've talked about indoor limits and outdoor limitations in terms of numbers of people. But again, when people physically distance, that makes a massive difference in terms of the potential spread and the risk of spread. When we use appropriate hygiene and when we wear our face masks. So again, we please caution people to be mindful so that we can all enjoy a healthy and happy holiday season time as we look forward to the month of December. That's it for me, Dan. Back over to you.
Thank you very much, Mr. Mayor. And we're just waiting for a moment for Dr. Mackie to rejoin the call. But Mayor Holder, in the meantime, I did see that there was a question in the queue that was for you. So I was wondering if we could maybe go to that question right now.
Sure.
All right. This question is from Andrew Graham at Global News Radio, AM 980 CFPL. Mayor Holder, earlier today, JMP Solutions celebrated the production of their 10,000th ventilator. Do you have any comment on the recent efforts in the fight against COVID-19 from this local company?
Well, hi, Andrew, and thanks very much for that. You know, I had the opportunity to do a Zoom video for JMP to celebrate the 10,000 ventilators and their contribution towards building them. I think it's a great testament to London ingenuity and our skilled manufacturing employment base. But also, you know, what it says is that when the need is there, London steps up. And what I've really appreciated about their efforts is what they have done to help keep Londoners safe, and perhaps more importantly, when there is a risk, that they provide the high quality equipment that will bring people back to health. Those ventilators really make a dramatic impact right across this province and country. So to JMP, we said it earlier, but I'm going to shout it out again. Well done. Congratulations to all the employees who participated in making those 10,000 ventilators. We in London are very proud of you, and we thank you very much.
Thank you very much, Mayor Holder, and congratulations to JMP Solutions. We are happy to be rejoined by Dr. Chris Mackie, so let's hear from him this afternoon. Dr. Mackie.
Thanks very much, Dan. So today we've got a good news and bad news situation. Provincially, our numbers have actually been flat for over a week now. That's really quite miraculous, given how steep the increase was earlier part of November and in October across the province. Locally, the picture is fairly similar. We're seeing relatively flat numbers for the past few weeks. potentially a slight increase, but again, nothing like the meteoric increases you've seen in other jurisdictions and even in Ontario earlier in the fall. So that's all very positive. The unfortunate news is that we did have another death, a gentleman in his 80s associated with the outbreak at London Health Sciences Centre. This was on one of the wards that has been an outbreak. The case certainly would have been inquired a week or so ago, potentially more, but the individual unfortunately has passed. I say this, we did have an additional 5 cases among both staff and residents diagnosed and reported yesterday. The death from today won't be reported in our statistics on our website until tomorrow, but it really is part of the initial wave that has gone through these wards. So felt it was important to get that information out as quickly as possible. And we're really hoping to turn the corner now and start to see this outbreak in the hospital really peter out. We've taken some dramatic measures. Staff have been really quite diligent to implement them. And so we're hoping that we're able to move on. And that, of course, will substantially change our numbers here locally, with 43 of our cases over the past week or so being associated with that outbreak. That's a significant contributor. If we're able to control that spread there, that will make a difference here. Dan, I'm happy to pause there and take any questions.
Thank you very much, Dr. Mackie. We do have a bunch of questions in the queue right now, and I'm going to go to the first one. And this one is from Steve Young at CTV London and News Talk 1290 CJVK. And it says it's for Dr. Mackie, but I think, Mayor Holder, it might also be for you. So I'll leave some room for you to respond as well. Steve asks Dr. Mackie, recent parties where Reopening Ontario Act charges have been laid have been hosted by young people whose principal residence is outside of London. Are the people who are hosting and being charged students? If so, where do they attend school?
I appreciate the question, Steve. You'll have to get that information from the police. Certainly, the health unit doesn't have the information about who it is being charged. I'm not sure if the mayor has more information, but as far as I know, that rests with the police.
Thanks, Chris. You are right. The specific information pertaining to those charged does rest with the police, but I will tell you, whether someone is resident of London or resident outside of London, they will be charged. And in fact, in these cases have been. And I think that's certainly a shot across the bow to say to those folks who blatantly disregard the rules that we're paying mind. And while, as we've indicated, it's not our first choice, we're not reluctant to issue fines as we need to ensure that we have the support that we need, as most Londoners do get it. You just get the errant ones who don't.
Thank you, Mayor Holder. Thank you, Dr. Mackie. Let's go to a follow-up question from Steve Young. Dr. Mackie, the University Hospital outbreak is also raising questions about who inside is testing positive. With medical students in that facility, are they the ones testing positive in addition to full-time staff and patients?
Steve, I can tell you that medical students have been taken off the wards in question. I can't tell you if any of the medical students have been tested positive at this point. I don't have that level of detail in terms of the positives. But in terms of how we handle flow of staff in those situations, we really are looking at sort of a lockdown where no one except the essential staff are on those wards, other than the patients who need the care. In the situation of medical students, I mean, this is a situation where, on a normal day, I would have said to you that medical students are essential staff, especially on those medicine units that are the clinical teaching units where medical students and other trainees play such an important role. This situation, we've decided that an additional layer of caution is appropriate for the student learners.
Thank you, Dr. Mackie. Let's go to our next question. It's from Jane Sims at the London Free Press, and this has to do with social media. Dr. Mackie, the question is for you. Jane says, Dr. Mackie, I noticed on social media yesterday that there were wide criticism of your comments regarding how safe our schools are. The health unit and the school boards have maintained that schools in the region are some of the safest places around. However, there is growing concern that asymptomatic transmission is going undetected and that there is more disease here than we are recognizing. Also, there are concerns that antiquated ventilation systems, especially in older buildings, may lead to more transmission, especially with winter approaching. I wanted to get your comments on those criticisms. Also, the education minister announced today that there would be rapid testing soon for schools in hot zones in and around Toronto to help detect asymptomatic cases. Would you like to see that program expanded to include Middlesex-London?
Yeah, so thanks for the question, Jane. I think that it's likely that people may have been interpreting the comments that I made as referring to provincial schools rather than local schools. The schools here in London and Middlesex are very safe, and I don't think anyone has any evidence to the contrary. And I think we actually have an abundance of data from those schools. You know, with the amount of testing that has been happening with anyone that has symptoms that could be COVID, it's, you know, theoretically there could be asymptomatic spread, but if it were contributing substantially to the numbers of students, staff, or others in the community, we would know about it because there is so much testing happening in that student and staff population. The schools have been very vigilant to make sure that that does occur. So quite confident in the statement that at this point, schools in London and Middlesex are very safe.
Thank you, Dr. Mackie. There was the question too about ventilation and if you had any thoughts or comments about the education minister's announcement today.
Yeah, so ventilation potentially can make a difference. You know, you'll also potentially see students being able to do less of their activity outside. That all may play a factor, but I think time only will tell. You know, there are a lot of other precautions, including screening all students and staff every day, wearing masks for all students. You have, you know, you've got sanitizer everywhere. The schools have done their best to reconfigure so that students have space. You've got cohorting. You've got eating lunch in a much more spread out way that rather than concentrated all at tables together. There are a huge number of safety precautions that all will make a difference. So hopefully the change around the winter season will not tremendously change the spread within schools. On the question of the rapid testing program, rapid testing certainly could play a role. I think it's early to say whether that would be necessary or even helpful here in London and Middlesex with the low levels of spread that we have here. The rapid testing is not as sensitive as the nasal swab. It only is somewhere around 50% sensitive. So having a negative rapid test does not mean that you don't have COVID. It means that this test has not picked it up. And if you absolutely need to know for sure that you don't have COVID, then you still require the nasal swab. So it's fairly limited, although it is rapid. We don't have a problem with speed here in this region. Our turnaround times from the lab at LHSC, the PALM lab, pathology and lab medicine, are incredibly good, have been leading the province for many months. And almost all of those tests are turned around within 24 to 48 hours. So the rapid test wouldn't add tremendously to the information that we're already able to gain here. One thing that will be interesting is if, you know, the rapid testing, if it's able to be deployed more broadly and even potentially to those that are asymptomatic, that will help us understand whether it is useful in the school setting. So the experience from other communities may inform what we do here, but at this point, not seeing a strong case for it.
Thank you very much, Dr. Mackie. Let's move on to our next question. It comes from Andrew Graham at Global News Radio AM 980 CFPL. Dr. Mackie, are there any concerns or is there any messaging you would like to share ahead of Black Friday?
Well, you know, certainly in terms of cross-border travel, we'll see a lot less of that this year. So that's a good thing. If already at this point we do have some situations in malls and large stores, department sort of stores that are seeing people becoming quite crowded. So that's already on the radar for us here. Certainly would be, one of the next steps if we require additional restrictions locally. And the Black Friday sales have the potential to exacerbate that. So it's definitely on our radar. Right now, we're not seeing a need for additional restrictions there, but watching that closely and hoping that malls and those large stores are able to do what they can to limit crowds gathering in their facilities.
Thank you very much, Dr. Mackie. Let's move on to the next question. This one is for you, and it comes from Megan Stacey at the London Free Press. Dr. Mackie, how many of the 16 new cases announced today are related to the outbreak at London Health Sciences Centre's University Hospital? And how many of the 6 new LHSC staff cases today are at UH?
Okay, so I'm actually not sure where the second part of that question came from, because from what I know, it's just 5 new cases associated with that outbreak. And I believe 3 are among staff and 2 are among patients, and they're all associated with the outbreak wards at UH. There is 1 additional case among a healthcare worker where we're investigating links with any of the existing outbreaks, but that hasn't been determined yet.
Thank you very much. All right, next question. Ashley Govius from the Western Gazette. Dr. Mackie, do you have any updates on the source of the outbreaks in Western's residences last week? Do you know whether the outbreaks are linked?
So we don't have a source for those outbreaks. Unfortunately, we likely won't get those sources definitively. And we can't say for sure, based on the information that we have, that the 2 outbreaks are linked.
All right, thank you, Dr. Mackie. And a follow-up from Ashley. Dr. Mackie, do you have any updates on the video that surfaced about Delilah's? Is the MLHU investigating, and were they the restaurant who was issued the maximum fine for failing to ensure employees and patrons are properly masked?
So I'll turn to the mayor to see if he has an answer to the fine question. It was City of London fines, I believe. The Delilah's video, we certainly did look at it when we were going through our investigation, and have been working with management there to make sure that when they reopen, they do so as safely as possible.
Mayor Holder.
Thanks very much. And with respect to that particular venue, I know the police are still reviewing and it's under investigation. I'm not aware of any fines that have been levied to this point.
Thank you very much to both of you. We have a follow-up question, Dr. Mackie, from Jane Sims at the London Free Press. Dr. Mackie, given our case counts this week, do you think the province has Middlesex-London under consideration for a move into the orange restrict category?
So I certainly think that, so the way the provincial decision process happens is that they review data early in the week. If there's a major change, it can be reconsidered. But at this point, it'd be most likely that data that we're seeing this week would be considered for next week's decision. And I would say we're right on the bubble. Each day, 16 is really a cutoff. I mean, we had the cutoff is 25 cases per 100,000 per week. And in terms of the case count, that would be about 16 cases per day here. So, today we had 16, yesterday was 18. Any day we're above 16 pushes us more towards the orange zone, and below pushes us more towards the yellow zone. So we're pretty close to that. But there are the other considerations. Our percent positivity in this area from last week's data is about 1.3%. So it's right in the range that would be considered for a move up. But our R0, the reproductive number here, is pretty flat. Our cases really aren't moving strongly in one direction or another. Healthcare capacity is definitely under pressure, primarily related to that outbreak. But at this point, LHSC is holding up in terms of capacity, and ICU is not stretched. Public health capacity, again, we're able to turn cases and contacts around within less than 24 hours in well over 90% of cases. So I wouldn't say, the data is suggesting that our public health capacity is holding up, although I can tell you that folks that are doing that work are working pretty hard right now. So all that said, we meet some of the criteria to move up, not others. I don't think there's a definitive case to be made either way, but certainly if things change over the next few days, that could push us in one direction or the other.
Thank you very much, Dr. Mackie. Let's go to our next question. It comes from Leni Lambrink at CBC London. Mayor Holder, this question is for you. Mayor Holder, you mentioned that many warnings were given to people in malls last weekend. Did bylaw gather any information about where those people were from?
Well, specifically when we talked about bylaw enforcement, reviewing shops for compliance or non-compliance, we actually had an extremely good result where no charges were laid. Where we had challenges was in one particular restaurant where there was a masking issue. But in terms of the malls across the city that our bylaw folks were involved in, the response from the community was pretty positive. So from that standpoint, it wouldn't be necessary for bylaw then to appropriate names for those where there are no issues.
Thank you very much, Mayor Holder. Let's go to our next question. Dr. Mackie, a follow-up from Megan Stacey at the London Free Press. Dr. Mackie, what are the rules for hospital staff going to work after COVID-19 exposure? Can they work if they're asymptomatic, or must all isolate at home? Is a test required, and what does that mean for patient safety?
Yeah, so for staff who have worked on the outbreak wards, they are all considered to have had close contact at this point, and so they are on work isolation. And what that means is that they need to monitor their symptoms actively at home and at work, report whenever any symptoms come out. They cannot work if they have symptoms, but they are in work quarantine, which means they can work. And I mean, obviously they can go home and nothing in between. So that's how those folks are being handled. Again, with masking of all staff, with the clinical environments, and of all patients now being added into those outbreak wards, you will see a real reduction in the risk associated with patient safety. So essentially the additional steps around work quarantine, masking all patients, and enhancing the vigilance around staff safety behaviors, we believe are creating a much safer environment. We're watching the case count and hoping that we can see this outbreak really well controlled by the staff actions there.
Thank you, Dr. Mackie. And I wondered if I could ask you a clarifying question on that as well, because we have heard through our general inquiries email that some people asking what that home situation looks like for someone who is on work quarantine. When they go home, is it regular at-home living, or are they isolating while they're at home?
Yeah, so folks that are in a quarantine or isolation situation are asked to keep distant from people in their homes as well. Ideally using a separate washroom, not involved in meal preparation for others in any way. So as much as possible, they're living a separate life within their own home.
Thank you for that, Dr. Mackie. I know we had several of those questions. Follow-up question from Megan Stacey. Mayor Holder, this one is for you. Megan would like to know if you have any comments on the 3 women charged for hosting Saturday's rally at Victoria Park. One of them reported to be a healthcare worker.
My comments about the organizers, and that's what they were, of this rally would be no different than anyone who hosts a house party or excessive crowds beyond the regulations. I think it's absurd and ridiculous that individuals knowingly flaunt the law disregard the health of others in the community and have such blatant disrespect for our community. I have no tolerance for that kind of ridiculous, inappropriate, selfish behavior. I think it about covers it.
Thank you, Mayor Holder. Let's go to the next question. Dr. Mackie, it is for you. It's from Matthew Trevithick at AM 980 CFPL. Dr. Mackie, do you have any updated case tallies for the 2 Western residence outbreaks?
Thanks for the question, Matthew. We haven't seen any increases in those outbreaks recently. So I believe we're still at 9 for the Saugeen-Maitland outbreak, and I don't believe we went above 3 for the outbreak at the other Western.
I believe that was
Western.
Perth Hall, Dr. Mackie.
Thank you, Perth Hall.
Great. Thank you very much. All right, we have one more question in the queue, and this is from Megan Stacy. Dr. Mackie's looking for some clarification on the LHSC numbers. Megan is asking, so with 5 new cases related to the outbreak, is that now a total of 43 cases related to the UH wards, 38 yesterday, plus 3 new staff and 2 new patients today?
That's right. So we are at 43 as of end of day yesterday. We don't have a count from today. We'll certainly keep you informed if we have significant number changes, and you'll see that mortality come up in our daily report tomorrow as well.
Thank you very much, Dr. Mackie. Another question just in under the wire from Matthew Trevithick for Dr. Mackie. Dr. Mackie, more than 8 months into the pandemic, is there a reason why the health unit is hesitant to identify establishments who are found to be in violation of COVID rules, considering the health unit identifies when those same establishments are in violation of health and safety rules through the DineSafe system?
Appreciate the question, Matthew, but I think you're probably talking about the municipality. We haven't been hesitant on those, and also haven't issued a lot of fines to those sorts of establishments. So I don't think I can answer your question, but I may be misunderstanding it.
All right. Yeah, that would be one. Matthew, if you want to email me later, if you're looking for some clarification, we'll see if we can give you a hand with that one. Thank you very much, everybody. Lots of questions today, lots of good discussion, and lots of important and valuable insights from Dr. Mackie and from Mayor Holder. We want to thank you for your time, for your questions, and for joining us this afternoon. We will be back with our next virtual media briefing on Monday afternoon at 2 o'clock, and we expect at that time to also be joined by the Warden of Middlesex County, Kathy Burkhart-Jessen. In the meantime, have a great rest of your Thursday, have a great weekend, and we'll see you next Monday.